Welcome to the recorded version of Navigating the Senior Care Maze, part of the Family Caregiver Support Webinar series brought to you by the American Society on Aging and a generous sponsorship from Home Instead Senior Care.
Our presenter today is going to be Dr. Amy Dupree. Dr. Dupree is an internationally renowned expert on lifestyle issues relating to caregiving, retirement, aging, and family dynamics. Dr. Dupree is president of Essential Conversations, Inc. and Dr. Amy, Inc., a company dedicated to family caregiver wellness. Dr. Dupree holds a PhD and master's in social work, specializing in gerontology, and she earned her CSA, a designation for which she also trains others as part of their accreditation. Dr. Amy Dupree is a much sought-after speaker at corporate and professional events on the topics of caregiving, aging, and retirement, and is a frequent guest on radio and television. And with that, I would like to turn the floor over to our presenter, Dr. Amy Dupree. Welcome.
Thanks, Steve. I appreciate that, and welcome to you. If you're joining us today, I'm sure that you know how difficult it can sometimes be to navigate the senior care maze as we're talking about today. So we're going to talk about this and make it hopefully much easier for you by the end of this hour. When I was caregiving for my own parents, which I did for about a decade, I know that even though I was a professional who had a strong background in this, it was still really challenging to figure out how to manage all of these pieces of their care. So I would know that I would have appreciated some of the practical tips that we're sharing today, and I hope for you that they make a difference too. You know, what we're really going to talk about today is the importance of us as family caregivers knowing about our aging parents' medications, doctors, various medical appointments, really all the vital information that people need when they're caregiving. I'm guessing that you may have been very common or experienced what's very common for many family caregivers, which is that you may have had some apprehension about potential problems with your aging parents. I know the thought of having the telephone ring late at night can be a very unsettling proposition for any adult child who has an aging parent. You think things like, well, what if my mother fell, or what if my father confused his medications and complications occurred? The truth is that one way for us, family caregivers, to lessen our worry is to make sure that we have our aging family members' vital information at our fingertips. You know, the more we know, the better prepared we'll be to respond quickly in the event of an emergency, and really just to better help our parents on a day-to-day basis manage their medical care. The reality is that many of us, when we're family caregivers, have pretty serious gaps in our knowledge when it comes to our parents' medical health. You know, there's so many things that we need to know that, one, we may not know what those things are, and two, we may not really be able to stay on top of them given all of the other things going on without some systems to do that. So the information we do have on our parents may not have enough detail in the event of an emergency. And as it says on this slide, it's important for all of us as family caregivers to know about our parents' medications, doctors, the medical appointments, and as we said, the vital information. Now, here's the tricky part. There's obviously a fine line between being involved in our parents' medical care and then being intrusive in their lives. So one of the things we do want to talk about today is we want to talk about how do we do that? How do we both get the medical information that we need, make sure that we manage and gather and maintain that information, and do it in a manner that maintains the dignity and the independence of our aging parents. Okay, so specifically, let's talk about what we're going to discuss today. We're going to begin by talking about the results from a survey of over 600 future family caregivers. Now, I'm guessing this probably won't surprise many of you that are listening to this, but the survey revealed that less than half of the respondents are knowledgeable about their parents' medical history. And I say probably may not surprise many of you because this may be true of you too. Now, again, as I mentioned, it's obviously important to know about your parents' medical information in an emergency situation. That's key. And when we look at that, approximately half of the people who responded to this survey were not able to name any of the medications taken by their parents. And many of the family members didn't know how many doctors their parents had or how to contact them. So in just a minute, I'm going to give you even more information about that survey, and you can see how you fall in comparison to some of the numbers we're going to be discussing. But I think it's pretty revealing about how little we really know when we are caring for our parents. We're also going to talk today about strategies for managing medications in a way that increases the likelihood that your older relative will be safe. As I'm sure you know, there are many medication-related risk factors for older adults. So we want to review those so you better understand them and that you can also share them with your parents as well. We're also going to talk about how you, as caregivers, can advocate for your aging parents with doctors and with other members of their medical team. You know, it may just include you being an extra set of eyes or ears at doctor's appointments, or helping them compile a list of questions to ask their doctor or their pharmacist. Finally, what I'm going to do is give you a few checklists and resources today that will hopefully help you, and again, are things you can share with your aging parents to help them become more knowledgeable and better organized, both in the case of that emergency we've talked about, but just for ongoing care. Okay, so let's take a look at those survey results a little more closely. Home Instead Senior Care, in conjunction with a group called the Boomer Project, surveyed over 600 future family caregivers. And what they were trying to do was to determine their level of knowledge and awareness when it comes to important information about their aging relatives. So the survey asked the respondents things about medical histories, medication usage, important documents like wills, financial records, and advanced medical directives, and whether they knew the names and contact information of service providers, insurers, attorneys, bankers, and physicians. Now, the survey participants overall felt they were pretty well informed about their parents' health situation. However, what the findings found was that there were some pretty important knowledge gaps. So, for example, less than half of future caregivers say they're knowledgeable enough about their parents' medical history to be able to provide details in the case of an emergency. Less than half. 3 out of 10 future caregivers did not know how many medications their parents were taking, and half of those are not able to name any of the medications that their parents are taking every day. So I'm sure you can see why those things are serious. Nearly half of future caregivers also say their parents have allergies to medications, but they don't know what those allergies are and they can't name the medications that they're allergic to. 7 in 10 future caregivers were not able to name their parents' blood type. In addition to these stats, nearly 2/3 of the people who responded to this survey's parents have at least 2 medical or health conditions. So again, these are the people now that the parents of the people being surveyed had at least 2 medical or health conditions, 2/3 of them. And the most common conditions are high blood pressure, arthritis, mobility problems, diabetes, and heart disease. And I'm sure as family caregivers you can appreciate that understanding the relationship between multiple medical conditions can be really challenging for family caregivers and for the aging parent. So again, for example, more than 1/3 of the parents have seen 4 or more different types of medical doctors in the last year, with the most visits being to primary care physicians, internal medicine doctors, and cardiologists. Nearly half of those parents take 3 or more prescriptions, over-the-counter medications, and supplements every day. And you know, the average number of medications taken each day is 3.4 by those surveyed. 6 in 10 future caregivers say they're knowledgeable about their parents' plans or wishes in case of an emergency, but actually fewer than half say they're knowledgeable about their parents' medical history in case of an emergency. 2 in 5 future caregivers have never tried to ask their parents for information about their medicines, 2 in 5, or about their doctors or insurance providers' plans for the future, although 2/3 say their parents are willing to talk about the information. So let's step back for a second and talk about those statistics and what they mean. So you can ask yourself, how did you do in some of those issues? Do you know about some of those things, about the medications that your parents are taking, about their allergies, their blood type, what their medical or health conditions are? Do you understand how these multiple medical conditions can all impact each other? And have you talked to your parents to gather the right information and to ask them the questions to know what they would want? That's the really key part. So I think what we want to conclude from this very important research was whether you are a future caregiver or a current family caregiver, like likely you are on the phone, we really need to all become better informed about our older parents' vital health and life information. The more that we know, the more likely it'll be that we can help our aging parents when they need it the most. And of course, we really need to encourage older adults to talk with us about this, but you heard from the survey, that's not as big a problem as getting us to talk to them about it. Okay, so now that we've discussed a little of that, let's move on and talk about the topic of medication management. So here's a startling statistic for you. Seniors represent about 13% of our population in the U.S., but you know what? They consume 40% of prescription drugs and 35% of all over-the-counter drugs. And those figures are all according to the American Society of Consultant Pharmacists. Thomas Clark, he's the Director of Clinical Affairs for the American Society of Consultant Pharmacists, and the ASCP Foundation says this. This is a quote from him. Medication issues are big topics for seniors. According to a recent report from the Centers for Disease Control, nearly 80% of Americans over the age of 60 use 2 or more prescription drugs, while 37% use 5 or more. Now, that's over the age of 60. I think if we were to take a look at over the age of 70 and over the age of 80, those percentages would go up significantly. So what this means, of course, is that we have a lot of older adults taking a lot of medications. So if your aging parent is seeing multiple doctors, receiving multiple medications, one of the things we know is that they may be at increased risk for medication-related problems, only because the right hand doesn't know what the left hand is doing. It's hard to be able to coordinate among these various doctors. You know, many older adults have 3 or more factors that put them at risk for medication-related problems. These factors include things like receiving the prescriptions from more than one doctor, which we just said, you know, this idea of one hand not knowing what the other hand is doing. And I just heard a story recently which really highlights this issue. So this gentleman I know was having problems with acid reflux, and he was prescribed a drug by a gastroenterologist, a specialist. A couple of weeks later, he went back to his family doctor, and the family doctor prescribed an iron supplement because he was anemic at the time. But you know what? The family doctor didn't realize what this other drug was that this person was on. He didn't mention it, and she didn't know to ask. She didn't know he'd seen this gastroenterologist. And there was a drug interaction caused by the iron. So the gentleman started having stomach pains and diarrhea and went back to the gastroenterologist after 2 weeks of having these symptoms to find out what was wrong. And the gastroenterologist asked her, had he started taking any new drugs? And he said, oh, you know what? I started taking iron. I forgot about the iron supplement. Is there any problem with that? Well, the gastroenterologist looked it up and said to the guy, yeah, there's a potential interaction with iron, gave the symptoms, and they were exactly what he was experiencing. That's exactly the kind of thing that can happen when you get more than one doctor involved. Really, nobody's fault, but if the doctor doesn't think to ask the question of, what else are you taking, you can get into trouble in these cases. Okay, so you see the second one on the slide is living alone. Living alone can really make worse several other problems, including things like vision issues and memory issues. So if you have an aging parent who's living alone, you really need to be more attentive to the potential of medication management issues and helping them resolve them. Again, I know of a woman who was living alone, and she kept mixing up her morning and her evening medications. The evening medications included a drug that was really sedating. So she was taking this drug in the morning and was falling asleep sitting in the chair watching TV. She was very groggy when she'd get up, and she was using a walker. So this was a big problem because it was making her more prone to falling. And the family was really trying to work this through, but what they didn't do was come up with a medication management system. They just kept trying to get her to take the pills at the right time without any real supports. Eventually, she did fall, and she did break her hip. So again, probably could have been prevented or something could have been done if someone had stepped in the family and gotten a system that maybe was the kind that dispensed the pills at the correct hour, and then if those pills weren't taken, sucks the pills back up into the machine. They might have just done well to lay them out in such a way and then call the mother. There are all sorts of things they could have done. But medication management issues are huge for seniors living alone. So again, if your parent's living alone, you want to think about this and what you can do about it. Okay, the third one you see there, vision problems or poor eyesight. This I saw with my dad. My dad had a lot of problems with his medications because of his eyesight. He had macular degeneration, and his eyesight was quite poor. And on top of that, my father didn't have very good fine motor coordination. He had lost a lot of the sensation in his fingertips. So he would often drop medication as he was taking it, and he wouldn't see that he dropped it, and he couldn't feel it in his fingers. Now, the medications my dad was taking were powerful, and they needed to be taken regularly and often at certain times. This situation with his vision and motor coordination was made worse because my dad was really alone in the house. Even though he was caregiving for my mother, she wasn't able to help him. He was caregiving for her, so it was very similar to him being alone. Excuse me, again, put him at more risk. You see the next one there says taking 5 or more medications, and that includes non-prescription supplements. I'm sure you understand that the more medication someone's taking, the more likely they're going to be medication management issues. There's more likely we're going to see things like interferences with the drugs, but just trying to keep them all straight. You know, my father used to know them by color and shape, and he'd say, you know, I have the white triangle and I have the blue pill, and, you know, that's how he knew his drugs. But he took a lot of medications, and it was hard to manage a lot of that. Another issue you see is being hospitalized in the last 12 months. That can cause problems as well. And I'm sure the next one, memory problems, are pretty obvious as to why this is a pretty serious issue for an older adult. If your parent has memory issues, I'm sure you know that they're very likely to forget to take their medications as prescribed, and they're going to need more supports in place to make sure they do that. Another thing that's key is making sure that prescriptions are filled at one pharmacy. As soon as you involve multiple pharmacies, it's more likely that the pharmacy does not have accurate records, may not know about the other drugs and possible interactions and all of those sort of things. So as much as possible, using one pharmacy makes a big difference. And another risk factor, financial issues. We know that many older adults start foregoing filling their prescriptions because they can't afford it, or they change how they're taking it so they don't have to get it filled as often. So make sure you check this with your parent as well. Is that an issue? Are they not taking the medication as prescribed because of that? Okay, now let's talk about some tips for safer medication management. We've talked about the risk factors, but we want to talk about how do we fix that now. One of the most important things you can remind your parent is that safe medication management is really, really important, and it requires proactive communication between your parent and their doctor. Now, if your parent isn't able to do that because they have dementia, certainly you need to be involved in that as well, and you may want to be involved in that anyway. You know, you can encourage them to write down all of the medications that they're taking, and I mean all of them, including the prescription medications, the over-the-counter medications, such as aspirin or laxatives or vitamins, any other supplements. They should bring that list to their doctor so that he or she has it on file. And then, of course, the key is keeping that list updated and making sure the doctor has the updated list. Now, I know both from professional experience and personal, keeping that list updated is a lot easier said than done. I remember that staying on top of the medications my dad was taking was very challenging. He had a couple of different doctors who would prescribe new drugs without always knowing what the other one was prescribing. In addition, my father would take various vitamins, occasionally use over-the-counter medications. I found it was easiest to keep this list on the computer and ask my father for any updates to it every couple of weeks. Now, it may seem silly to think it needed updating that frequently, but I really found that almost every time he went to the doctor, there'd be some little adjustment to his medication. And I find that he'd try some new vitamin, or he'd stop taking some supplement because it bothered his stomach. So every couple of weeks, I would just say to him, hey, can we just go over the medications quickly? Just took a few minutes, and we'd review the list, and I'd get the updates, and then I do them on the computer, and I made sure my father had a list, and I had a list, and the doctor and pharmacist had a list. And you know what? Doing that ensured that he and I always had the most current version of whatever he was taking. And there were a couple times my father did end up going to the hospital, and this became extremely important. Now, beyond keeping a list of medications up to date and making sure the doctor has it, there are also many important medication-related questions that your parent will want to ask their doctor every time they're given a new medication or one of their medications is updated. And again, this may be something that's important for you to be involved with because they may need your support in this if they're unable to manage this. So some of the questions they should ask, or you should ask, is how does this drug interact with the other medications I'm taking? And again, that's often a trigger for the doctor to remember to look at those other medications. You know, in the short doctor's appointments we have today, it's often easy for doctors to miss some of these things, not because they don't care or they're not interested. It's just hard to stay on top of it all. So, important question. What are the benefits and risks of the medication? Another important question. What are the side effects of the medication? And what do I do if they occur? In other words, do you stop taking it? Do you have to wean off this medication? Should you stop the other medication if there's an interaction? So all of those kind of questions are important. What food, drink, other medicines, or activities should I avoid while taking the medication? You might really think about the fact that you may need to sit down and help your aging parent write key questions ahead of time and maybe even go to the doctor with them to make sure that one doctor is overseeing all the medication. I found that my father really, really appreciated when I was able to go to the doctor with him because he found it extremely stressful to do that alone, not because he wasn't, he was cognitively fine, but my father just found it hard to manage all that information. Now, you may need to talk with your parent because this, again, is a respect issue that we really, need to respect that they may not want you to go, but they may want you to go. So, or another family member or a friend or someone. So just chatting with them about this and saying, hey, if I could go or someone could go, would that make it easier for you? Or would you prefer to go alone? Is often just the opening they need to ask for your help. I know that even for myself, sometimes having another set of ears to hear the information and recommendations can be helpful. Not because I'm not capable or your parents may be perfectly capable, but it's simply hard for us to take in all that information that the doctor's telling us as quickly as they tell us, and to remember to share all of that information as well. Many older adults I've worked with have gotten home and then wondered if they really understood the specifics of what the doctor said. So if you as a family member are able to go there and take notes and verify the information with the doctor, it can really be a big comfort to your parent. Finally, I think don't forget about the pharmacist, and you may need to remind your parent about this too. Pharmacists can be a very important source for medication information, and we don't always think to turn to them. Beyond the information sheets that come with prescription medications, which we're all familiar with, pharmacists are really good at answering questions about the medications being prescribed and possible interactions with other drugs. Now, there's limits to what the pharmacist can discuss with you. For example, they can't discuss a diagnosis, but they can talk about the drugs, and that's why it's a great idea to have your parent or, again, you, when they ask if you want the consult on the medication, to say, yes, I do want the consult. You get so much good information during that time that it's really important to do that. So, again, I think reminding yourself and your parent that you have a really important role in helping your parents manage their medication. And when you're actively engaged in the ways that I've just described, it can really reduce the risk of medication-related problems for your aging parent. So we've been talking about, obviously, this whole issue of medication management. Let's now talk about the information and resources that you and your parent should have to help them with both their daily routine and in case of an emergency. So you see on the screen it says information management, and it says important information and documents for family caregivers. So let's start by identifying the information and documents you need to know about and to be able to access. That's really key, especially in the event that your parent experiences a medical emergency. So the most important documents include what you see on the screen: wills and testaments, powers of attorney, healthcare proxy, financial information, and that includes bank locations and account numbers, the safe deposit box key, Medicare, Medicaid cards, and the Social Security number. I really want to encourage you to think about creating and or gathering these documents as soon as possible, and make sure you and your parents all know where they're kept, and that the appropriate people have copies. It might be other family members, and in the case of legal things, it may be the lawyer. I'm sure that you've heard stories about other families who've had issues in not being able to find these documents at a crucial moment, or even in knowing if there's a will or a living will that's available. So all of this is really key, and it's gotten more complicated now in some ways because of the computer. If your parents are on the computer, you want to make sure that you have passwords as well and all of those kind of information. Making a list of these documents and where they're kept is another really great suggestion that you can do. And by the way, as you're doing these for your aging parent, you might want to do them for yourself, because we all really, really need to have this information at our fingertips. Okay, let's take a look at another suggestion that might help you in handling this information. So the next step is thinking about compiling a comprehensive list of the names, addresses, telephone numbers of all of your aging parents' key providers. And you see a list of these on the screen and people you need to think about. So their health insurance agent or provider, their long-term care insurance agent or provider if they have long-term care insurance, their primary care physician, their accountant or financial advisor. And you know, you want to encourage your parents, if they're willing to do this and it makes sense for you to be the person or whomever to be the person, that you make sure that you get added to the people who can call the doctor and talk to the doctor if your parent's comfortable with that. Because as you know, because of HIPAA privacy regulations, if your parent hasn't put that in writing, it's going to be very hard for you to communicate with the doctor, and the doctor is unable to really give you any information back. And I get this question asked a lot by people who are dealing with a family member with dementia, and they want to call the doctor. Well, they can talk to the doctor. The problem is the doctor can't really talk to them. So getting your parent to do that and making sure that you have someone who also can call is key. You might think about working together with your aging parent to compile the information and locate and copy the documents. You know, this can be pretty overwhelming to try to do on your own. And so asking them to do it alone may be too much. You doing it alone may be too much. Doing it together may be the way to go. I think that really, having worked in this field for so long, that I believe that families would be more diligent about doing this quickly if they knew how important it is in the case of a medical emergency, and also just in the case of managing things like the medications and doctors and appointments. So I really suggest to you that you take the time to do this. It's key. I know that you may be hesitant to ask your aging parent about these things because you worry you might feel like it might be intrusive to your parent. And you know, we've never talked about financial stuff, and our family doesn't discuss these kind of things. I've heard this a lot. My parents are very private people. As you heard earlier in the survey, usually the older adult understands the importance of having this information on hand in the case of emergency, and they're willing to talk about it. It's us as adult children who have to understand how important it is to do this and then take the steps to do it. And of course, how we approach our parents on this makes a huge difference. So I want to encourage you to think about the way you say it to your parents and the purpose. Something as simple as, you know, Mom, I'm thinking that it would be a good idea for me to have, and you can name the specific information, because I realize that if there were an emergency, I would not know how to access any of that. I wouldn't know where it is. And again, we know that aging parents are really good about that. Okay, so there's a way you can help organize all this information, and you can help your parents in tracking and the medications and all of this these vital documents we're talking about. The Home Instead Senior Care Network has worked with the American Society of Consultant Pharmacists and Humana to develop a very useful toolkit to do this. And we're going to give you the website in the question and answer so that you know how to get on and to access this. The toolkit provides you with everything you need to be prepared for the emergency. It also contains several important worksheets, including one where you and your aging parents can record the medications, the dosages, and other really important medication information. So again, key things that you want to have at hand. Let's talk about some other resources that you can take a look at beyond these. So you see here some websites that I want to share with you. These are online resources where you can learn more about medication management. So you have there the American Society of Consultant Pharmacists. This is a really big organization of 1,500 North American consultants and senior care pharmacists who are specialists in geriatric pharmacotherapy, and the unique medication-related needs of the geriatric population. You can get more information on their website, which is there. The Commission for Certification in Geriatric Pharmacy, which is the second resource there, you see their website, that provides information about geriatric certified pharmacists. Now, I became a real believer in the need to sometimes consult a geriatric certified pharmacist after my mother had a massive stroke. And my mother was in a rehab facility, and she was there for quite a while. And one of the things they often do with stroke patients is they put them on an antidepressant. And they do that sort of as a matter of course. And they did that with my mother, and along with a number of other drugs that she was taking. And one of the things that happened with my mother was she became quite aggressive after the stroke, and surprisingly so. And my mother had only use of her left hand. She was right side paralyzed, and she was in a wheelchair. And my mother was very aggressively trying to escape from this facility, and was swearing at the staff and becoming quite belligerent. And my sister, who's a nurse, had a brilliant idea, which was to take the list of my mother's medications to a consulting pharmacist and see if the pharmacist thought that anything that she was taking or a combination of things were interacting to cause any of these issues. And he identified the antidepressant that she was taking as one that often caused aggression in older adults. So we requested that that drug be stopped and that a new drug be started with her so that she could try another drug, and it worked. Her aggression immediately went away when the drug was out of her system, and it never came back. And again, when we talked to her doctor and the pharmacist who had prescribed it originally, they were not aware of that side effect in older adults. So that's the kind of thing that you get when you consult with a geriatric pharmacist. You see the next resource on there is the Center for Improving Medication Management and the National Council on Patient Information and Education. So these provide information about the safe use of prescriptions and over-the-counter medicines. And their website is up there as well. Now, that's just a few of the many resources that you can find, but they're a great starting place for you to start looking at this. And obviously, the more good information that we have, the more likely we'll be able to provide excellent care for our aging family members. Okay, let's take a look now at the next steps you can take after here. Okay, so in looking at the next steps, some questions you can ask yourself. Do you need to discuss medication management with your parents? Is that something that you feel you know everything about? Do you know about their vital information and where all their important documents are and how to access them? And how about the resources? Do you feel like you know enough, or do you need to explore some resources? And again, in thinking about the resource I was mentioning to you before about the toolkit, going to caregiverstress.com is a resource of where you can go and download that toolkit where you can organize all those documents. And Mary Alexander from Home Instead is going to join us in a few minutes, and she can talk to you about that even more. So I think looking at the resources, knowing what you need, and thinking about what is it you need to do next. And the question that isn't on here that I want to really mention as a possible thing you want to think about is the way you talk to your parents about these topics, because that is key. Making sure that we maintain their dignity, their sense of independence, explaining why we're asking for this information, explaining why it's important that we know this, are all key things. And a lot of times it's the approach that is the most important part of this. So we can talk about that more during questions and answers as well. Speaking of which, I'm going to turn this back to Steve, who's going to take us to questions and answers, and Mary Alexander is going to join us.
Thanks, Dr. Amy. A lot of great information. And as you just mentioned, it is time for the Q&A portion of today's event. So please text in your questions using the questions box, and we will pose them to Dr. Amy, as well as Mary Alexander, who's joining us on the line right now. Welcome, Mary.
Hello, Steve. Hello, Amy.
Hi, Mary.
Okay. The first question. My mother is a very private woman and will not discuss her medication and health issues with myself and my brother. It seems that there are times that she has problems with mismanagement of her medication. How can I get her to understand that I can help her better manage her medications?
You know, I'm going to go ahead and talk or answer that question based on my personal experience. I'm actually going through that with my father right now. He's very private about his health conditions and his medications and his finances. And when Home Instead put together the senior emergency kit, I went to him and I said, Dad, I want to see, you know, if this really works. You and I'd love to have a conversation with you about the things that are most important to you. So if there were ever a problem and you weren't able to speak for yourself or make decisions on something that was critical to you, I want to know what that is so I can step in on your behalf and do it exactly the way you would do it. And that opened up a line of communication. I'll tell you, it took us several conversations to be able to have him share truly the information I was looking for. But we were able to start the dialogue and really take small bits and pieces at a time to figure out where he was with his medications, with his health issues, with his finances, where his papers were, until I was able to collect all the information I needed to feel comfortable being able to step in if my dad should need me to do that. So it's a slow process, and you need to be very patient and explain to your parents that you're doing it just so that you can truly be their advocate if they can't.
Yeah, great answer, Mary. And I think, again, you know, Mary's description of how she did it is such a wonderful way to get the information, and the conversation that she had is so important. And I think that's the thing we want to remember. A lot of times I think as family caregivers, what we forget is what it feels like to be on the other side of this. And I think that that's something we have to remember, is the feeling when all of a sudden people are, you know, feels like it's everybody's in your business. And so how you frame that and how you have those conversations often makes the difference between not just success in getting the information, but how your aging parent ends up feeling about those conversations and about where their lives are. And I think it's hard for us a lot of times because we're in task mode. We got to get it done, and we forget the emotional side of it. So balancing those two things is important.
Okay, the next question is somewhat similar, and it is, my mom is also a private person. There's been a couple instances where things have reached sort of a crisis level, and I had no idea that there were some issues going on all along. I'm getting concerned that as time goes on, there's going to be an even bigger problem that happens. How can I get my mom to respond and open up a little bit more so that I know that there's an issue going on before it reaches the crisis stage, at which point things are way worse off than they would have been?
You know, I think, you know, that's a challenge for everyone. You know, we want to make sure that our parents are cared for and there's no problems. But the reality is things happen in life, whether it be an accident or an unforeseen circumstance. So what I would say is this. If your parents are cognitive and able to make their own decisions, we have to let them live the way they want to live, even if we don't truly accept it or want something different for them. I mean, that's the part of growing up and living where we live and making our own decisions. If your parent is not cognitive, there's a whole different conversation to have, and I'll let Dr. Amy talk about that.
Yeah, I love what you just said, though, Mary, because I think we forget that people have a right to make decisions that we may not agree with. And I think we can have conversations around this with our parents. And again, this is assuming that they're cognitively intact, they don't have any major dementia issues going on, that we're not intervening on behalf of their safety for those reasons. But I can remember a conversation I had with my father in one of these cases that my father was cognitively intact, and my mother had the stroke, and he was her major caregiver, and I was trying to manage kind of both of their care. She was not yet home from rehab, and my father, who had a balance issue, got up on a ladder and cleaned out gutters with nobody around. And I remember he and I had this conversation, and I said to him, Dad, that just really concerned me. And he got a little upset with me. Well, I have a right to get up on a ladder, and I'm able to do this. And truth was, he probably wasn't all that able to do it. And I said to him, it is true. You do have the right to make your own decisions. You're an adult. I don't have a right to tell you what to do in any way. But I'm hoping you can see it a little differently in this case, in the sense that now everything you and I do kind of impacts each other because we're a team taking care of Mom. And he got that when I came at it from that standpoint, about that it was about my mother, not about me trying to tell him what to do. And I said, so, if you've fallen off that ladder, I've lost my teammate, and now I've got 2 people to care for. That conversation made a difference in how we work together. But it was, I hope, the way I approached it that softened it a bit for him and made it a little easier. So that's just to say what kind of continue Mary's theme. That's my comment on that. But Mary had another very, very important point. If your parent has dementia, and what do we do with that? Then that's a very different situation, because people are not able to make sound decisions, especially as they progress through the disease. So what you need to do then is have a plan to involve, hopefully, the doctor to understand what's going on, to try to have professionals who are there to support you in making sure that your parent has a safe living environment. In the very, very worst case scenario, if your parent is not willing to have anybody engaged, you always have the option of calling Adult Services, which is a part of the Department of Social Services in every county. And Adult Services is there to make sure that if there is an issue, your parent can be called, or your parent can be taken care of. So it's Adult Protective Services. I've said it wrong twice now, so let me say it correctly. Adult Protective Services, which is a part of the Department of Social Services. What they will do is go out and do an assessment, and if there's a safety issue, they'll intervene. Now, typically, they only intervene if it's a very serious safety issue and there's dementia involved and there's no other solution. So you want to really make sure that you exhaust every other possibility, friends, family, calling the doctor, to try to get this taken care of before involving them. But we can never ignore safety situations. So Adult Protective Services is there to make sure that safety is upheld in the case when people are no longer able to make those decisions on their own.
Okay. Speaking of mild cognitive impairment, this next question kind of applies to that. The question is, my father has mild dementia, is still living at home, and everything is pretty okay. He does take multiple medications, however. When I'm over, I sometimes get the feeling that he has skipped or forgotten some of his medications due to some of them still being in this pill container. The issue lies with some of my siblings who I feel might possibly be in denial about his situation. They insist that he's been taking the medications and everything is fine, when I can clearly see that that's not the case. How do I handle this potential conflict with my siblings?
That's a challenge. When the siblings aren't all on the same page, there becomes a whole nother issue other than just what your parents are dealing with. I would suggest first, just from a sibling dynamic perspective, that you visit caregiverstress.com. Again, that's caregiverstress.com, and click on the 50-50 rule. And really, it's a program designed to help siblings deal with mom and dad's issues as they age. Again, it's just a great foundation to get your siblings all on the same page. But with that said, the underlying issue here is the medication compliance. And whether it's for whatever reason, whether it's dementia, whether it's they just simply forget, whatever the reason, there are options out there that electronic options, first of all, that will assist with letting you know if the medication was dispensed. It doesn't tell you if it was taken, but it tells you if the medication was dispensed. And there's a couple that come to mind. You know, one that we tend to use a lot in the home care space is the PMD model, which was created by Philips Lifeline, which is a personal emergency response system. They have a pretty good one. It's hooked up to a phone line and it gives you alerts. But there are lots of other options out there. You can do a Google search and find medication management solutions. But you know, there's some other things you can do. One sibling can be in charge of the medication, and that becomes their role. Now, if you're not there in the home, you don't know if they've taken the medication every day. But if you're there filling the pill boxes and you're there each week and you can see what was taken and what wasn't, you also know when it's time for refills, if it's happened on the right day. It takes someone diligent to do it, but you certainly can manage that without an electronic option. But again, it can't be the whole family managing mom and dad's medication. Really, you need to find a person that's going to do it and do it, again, diligently.
That's a great answer, Mary. Yep, I agree with everything Mary just said, and I think the idea of dividing tasks with siblings is a great one because then somebody is in charge of something.
Speaking of that, that is related to our next question. We're at the point now where we have to divide tasks between a group of us siblings. There's been some strained relationships between some of us over the years and a lot of ongoing issues that haven't been resolved. We're now in a situation where we need to act as a team, and it's become extremely difficult, a lot of old wounds coming up, things of that nature. How do we handle this now that the cards are on the table and it's important for us to pull together?
You know, I've dealt with a little bit of that even with my own situation. It's interesting. You know, I'm in the senior care space, and so I have a lot of great resources and information at my fingertips. But my siblings see me as the know-it-all, and so they don't necessarily want to listen to what I have to say or take what I have to say as, you know, as a direction we should go. So I would say this. If you've had issues with your siblings in the past, they're not going to magically disappear because mom and dad need assistance. What you need to do is figure out what we call a care plan. And the care plan is list all of the things that mom and dad may need, whether it be doctor appointments, transportation, or managing meals, or cleaning the house, or managing finances, or the medication management we were just talking about. List all the things that they could possibly need. And then list who is best able to do that, from either a financial ability to do it or proximity. You know, I was lucky. I purchased the house next door to my mom when she was ill. So I was the one that was there every day making sure that she had gotten out of bed, I was able to help her get dressed and get breakfast before I went off to work. My other sister, she happened to be a chef, so she made all the meals and did all the grocery shopping. My other sister had kind of a limited schedule, so she did all of the scheduling of doctor appointments and physical therapies and all of those things. So it took us a good month to really get our feet under us and realize that we had to be okay with our siblings taking over their role and managing it, and that we didn't have to have consensus on everything. And that was probably our biggest hurdle, but it really becomes what can you realistically do, and realize not everyone in your family is in a position to help financially or help with the amount of time that you may have in your schedule. I mean, everyone's balancing, you know, work and families and other things. So you have to be open to what the ability is of your siblings and be okay with that. And remember, I think the biggest challenge for me was they didn't have to do it my way. Everyone could do it their own way as long as the task got done.
Okay, next question. Do you have any insight onto long-distance caregiving? Both myself and my sibling live several hours away from our aging parents.
Well, I think, you know, both Dr. Amy and I we both have done long-distance caregiving.
Yes.
And it's challenging. As a matter of fact, over my lunch hour, I ran out to to Home Depot to buy grab bars so that I could FedEx them to a friend of mine in Arizona to put them up so my dad could take a shower. So again, managing long-distance caregiving to me is almost harder than doing it when my mom was next door, because I don't have eyes and ears, and I don't know how he's feeling. I don't know what his mood is. I don't really know if he's eating. You know, I'm trusting these things are getting done. You know, and I have the definitely the benefit of having Home Instead in Phoenix to help me manage this, but it's hard. You know, the hopping on a plane when my dad has taken a turn for the worst, or just knowing, talking to him on the phone that he's bad. You know, those are the things that I think break my heart and become really challenging for me because it affects every part of my day.
Yeah, and I agree with you, Mary. I think it is a challenge. And Steve, can you read the first part of that question again?
Yeah, it's about insights on long-distance caregiving. Both myself
and how to manage
my sibling live some
Yep.
hours away from our family.
Okay, and Mary, I might have interrupted you. Were you done? You maybe have more ideas.
I'm done. Yep.
Okay, so the thing I would say is, again, I think trying to set up someone who can be, as Mary said, the eyes and the ears, really important. You can do that informally. I also was long distance from my parents a lot of the caregiving time, and I found I needed to have somebody who I knew I could call who could give me a different perspective on what was going on there. So there's a couple ways to do that. Obviously, if you have professionals involved, that's a great way to do that. If there's a family friend in the area who you can chat with, it can be informal. Another thing that I found, and I know caregivers really struggle with this, is you worry about if there's an emergency and what are you going to do, you know, and who could go. Now, in the case of my parents, my father was the caregiver to my mother, so one of my concerns was if my father, something happened to him, that he had a heart attack or something, I needed somebody to be with my mother who required total care until I could fly in. And that kept me awake for a while. And I know in working with caregivers, often these kind of issues, you stay up at night worrying about. So what I did was I called everyone I knew who lived in that area that knew my parents well, and I asked them, would they be willing in the case of an emergency to take that role? And I ended up creating a list of, I think, about 10 people, had their phone numbers, had their names, got all of their permission, had that list at my parents' house as well as at my house. Never had to use it, but I have to tell you, it gave me great peace of mind to have backup in place. And I think that is really key to make sure you do that.
Okay. Mary and Amy, you both mentioned as part of the main presentation about the caregiver toolkit that would be available online. Can you talk a little bit more about where we can go and get that?
Mary, can you give that?
You bet. You know, the Senior Emergency Toolkit that we created with Humana was really designed to be a one-stop shop for critical information dealing with your senior. The thought behind it was that you would keep a copy with you so that at a moment's notice, if it's 3 in the morning, you could put your hands on those documents to be able to give critical information to a healthcare professional. You also leave one at your senior's home in an easy-to-find location just so that it was there as well. And that can be found. It's a downloadable document that can be found on caregiverstress.com. And in the search field, just type in Senior Emergency Kit, and it'll pop up, again, with all the downloads and information. This document is meant to be a dynamic document. Things change. Medication changes like Dr. Amy was talking about earlier. So this is really meant to be kind of your guide to assist you with critical information that your senior needs at a moment's notice with healthcare professionals or when making decisions for your seniors. So I encourage you to download those documents, read some of the information behind it. We also have formal kits that are already created that your local Home Instead Senior Care Office would be happy to send you if you have one in your market, which I'm sure that you do. But if not, if you'd rather download it, again, it's caregiverstress.com, and in the search field, just type in Senior Emergency Kit.
Okay, next question. I have 2 sisters whom help in the care of my father. Every time I bring up finances, wills, power of attorney, etc., my sisters feel I'm being insensitive. I just want to understand my father's wishes. How can I help them understand how important this is?
This is really key, and I think it's a great question, and this is, again, all about the conversation and how we can have it in a sensitive manner. You know, I speak on this topic a lot, and I say to families when I speak on this, all of us have lost people that we love. And, you know, if you're an adult, chances are you've lost someone you love. And we know that what you want to do for the person you love, both before they die and after they die, is carry out their wishes. And so that's what we're talking about here. And the person who wrote this said it that way. You know, I want to carry out their wishes. So that's the conversation you can have with your parent. You can say, you know, it's very, very important to me that I know I do what it is that you want. And I talk about this from the standpoint of what would they want for care if they needed care. What would you want? So it's not just about, you know, what do you want? Do you want to be cremated or buried? This is really about what do you want so that you have the life that you want right to the very end. What does that look like for you? And I found very few families do this. And again, when it's handled from the standpoint of I want to carry out your wishes and I want to support your independence, people understand that. Now, that doesn't mean everybody's going to sit down and say, let's have a long conversation. You kind of have to base that on the personalities. My mother was great about this. She could talk about anything. And I joke that, you know, she shared everything she wanted. In contrast, when my dad got to that stage and I realized I didn't know what he wanted, and I asked him, his response to me was, I just want what your mother wanted. And I said, you know, I think I need a little more detail than that. And so my dad and I kind of laughed about it, and I would just ask him a question when I'd visit, and I wouldn't turn it into a big, heavy conversation. But it was always from this standpoint of, you know, I love you, I care about you, and I want to do what you want, and I have to know what that is to do it. The other thing you could do is make it a mutual conversation. Any of us who are over the age of 18 are old enough to be having these conversations. So you can say, I'd like to share with you what I'd like too. And that way it's not just about your parent. You know, Mary, Amy, you might want to add something.
Yeah, you make a great point. It's interesting. I had a lot of great conversations with my mom before she passed, but we didn't necessarily get everything covered. And when we were going through her will, and she left me, of all my siblings, the contents of her home, I could not figure that out for the life of me. Like, why in the world would my mom leave me the contents of her home and not split that up with my siblings? And it's interesting because about 1.5 years later, I found a letter that she had tucked in a box that I had just never opened. And there was a letter explaining to me why she left me the contents of her home. Is because she knew that I truly wasn't attached to very many things in it, and that I would be incredibly fair when it came to dividing things up between my siblings. So again, I think it's interesting, the thought process. Our parents really have a lot to say. We just have to give them the platform and the ability to say those to us. I wish she would have told me that when she was alive, but it's okay. At least I figured it out at some point. But it was always perplexing to me as to why. So
that's a great example, Mary, about, you know, things that happen that if a conversation would have been perfect for that, wouldn't it?
It would have.
Okay. Well, we are just about out of time for today's web seminar session, but I want to thank both of our presenters today for another great presentation, Dr. Amy Dupree and Mary Alexander. Thank you for joining us.
Thank you. My pleasure.
Thanks, Steve.